This is Where We Live on Connecticut Public Radio. I'm Lucy Nalpathanchel, broadcasting remotely. It's important to not lose sight of the fact so many Americans have died from COVID-19, over 119,000 people. They include more than 4,200 people in Connecticut. People we know have also recovered from the disease, but what they go through can be really difficult. Today, Where We Live, we want to learn more about what recovery from COVID-19 looks like for people in our community. Have you or someone you know been hospitalized due to COVID-19? How would you describe your recovery? We want to hear from you today. 888-720-9677. That's 888-720-WNPR. You can also find us on Facebook and Twitter at Where We Live. Now, coming up, we're going to also learn how survivors are donating their blood plasma to help others defeat the virus. First, we want to talk about the effect COVID-19 has on someone after they've been hospitalized. Joining us now is a Connecticut resident who is recovering after being diagnosed with this respiratory illness. Richard Gard is a Connecticut resident, also a lecturer at Yale Yale School of Music, and director of music at St. Thomas More Chapel and Catholic Center. Richard, thank you for joining us today.
Thank you for having me, Lucy.
So tell us, before you were diagnosed, was it around the time that the pandemic started? And how were you feeling before you started to feel a little bit off?
I was considered very healthy and very fit. A sailor. I'm an advanced scuba diver, and I'm very active at Yale with all my students, my choirs. I run the world's largest online free hymnal for churches. Mm-hmm. And I was also my wife and I were very careful with washing and, trying to be safe, but never, ever thought that I would be sick. And I became sick in early March at some point. And then it went, I got sick really fast after that. But before then, I would have never thought ever that I would become so ill or ever come close to losing my life.
So tell us, when you said you started to feel off in March, how did you feel and how quickly did you have to go to the hospital?
It was one night I was having tremendous, my heart was beating out of control. I couldn't breathe. And so my wife insisted that I call my doctor with the Yale Health Plan. And she thought that I'd had a heart attack possibly and told me to go right into emergency. And while I was in there, I would have this crushing chest pain, inability to breathe, and a headache, eventually. So the pain was so bad that I was in, I didn't realize they were giving me morphine. And but soon I told them, I said, I don't think I've had a heart attack because I feel like maybe I have the flu. And they said, so eliminate heart attack, yes. Not sure what to do with me. And because really none of the pandemic here had really started. And eventually they decided to test me for flu. And they took a swab, and that took a couple hours to come back while I was still very distressed laying in emergency. And I'll never forget, the doctor came back and said, you do not have the flu. I said, okay, great. He said, no, not good.
Oh.
Means you probably have new coronavirus. We do not have a test yet. We're going to put you in isolation now. And so I was the first person to be suspected of coronavirus at Yale New Haven Hospital and for the university. And the university swung into action immediately, canceling when they realized, one of the faculty was now hospitalized with it. And the hospital, and they said, we have been studying what to do with this, but we're somewhat making it up as we go now that, you were really here. And I was very ill by that time.
That must have been so scary when your doctor said that they think this is from the new coronavirus. What was your reaction? Obviously, you were feeling ill, but your family must have been so scared, Richard.
Yeah, the word for me, I always thought, well, I'm healthy. It's going to be like the flu, and I'm going to get over it. I'm a positive person. But my wife, she had stayed there with me, and they just, threw her out of the hospital immediately and told her to get into isolation. And we didn't even really get to say goodbye because they just ripped me out of there so quickly and into one of their negative airspace isolation rooms, which was a very, very nice. I mean, and while I'm talking about, I really owe my life in so many ways to Yale New Haven Hospital and Yale Health Plan, who the doctors, everybody, approached it. They just so open to trying things and being careful. And when I was in great danger, moving with utmost speed, and since then supporting me. I'm just constantly supported by them, and so just while we're here, I really owe my life to all the doctors, nurses, and staff at Yale New Haven and at Yale Health Plan. But yes, it was very scary because then you're in a room, and this I never realized how important it is to see people, especially I as a teacher and a conductor. I work with a lot of people, and from that point on, for the rest of that month, I never saw another face except on TV, which really doesn't count as seeing a person. The rest of the time, everybody was extremely protected behind, double masks, shields, hats, the whole thing. I only saw eyes, and I just learned people by their voice. But and that I realized after it can really drive you into like a depression or like a real sense of being alone, of not seeing any person, only eyes.
Yeah. You're hearing Richard Gard again. He's a Connecticut resident, a lecturer at Yale School of Music. He's recovering from having COVID-19. Today we're focusing on what that looks like for so many Connecticut residents and their families. We just heard Richard say when you're diagnosed with COVID-19, you have to be isolated from others, and that is a scary time to not be feeling well, but also to not see your loved ones in person. So Richard, when you were at the hospital, can you recount what those days were like? How long were you hospitalized? And at times, were you preparing for the worst?
Well, when it was the worst, I was in la-la land. But that was a terrible time for my wife and kids. But I was hospitalized a little more than 2 weeks altogether, and I was in ICU for 5 days, and I was on a ventilator for just about 3 days, so not too long for any of that, which is part of the reason I'm having a good survival. I'm recovering because I wasn't on the ventilator too long. But and what's strange is it wasn't all bad. And I had a lot of time to think when I was there. It's like there's pain, there's guilt, there's comfort, and there's joy that I had in the whole thing, because, of course, there's lots of pain from it, and there's lots of, especially since they didn't know what was hurting me, there's a lot of blood draws, and there are huge IVs that are associated with being intubated. And you're tied in a bed, and you have a tube in you, and you have to just chill and just go with this thing when it's breathing for you. But and for me, they would have the TV news on at times, and at that time there was so many statistics of how many more are sick, how many had died. And after I woke up and I was intubated and I was in ICU, and I would see those numbers, and I realized that I could have been just a digit up there. And when I was in the coma, I did have dreams or things that happened to me, and I realized that really all the time, the line between being alive and dead is an extremely thin line. Like you could step back and forth with ease. And I said there's guilt, because at the same time I felt so bad for what my wife and my kids went through. I think way worse than I went through being sick. And also all of my programs, I have students who are graduating who are, hoping to start a career as a teacher. I have students that were at prime, ready to start a career as a performer. All of my church music things that I do that are out there, and just at a time when really everybody needed to pull together to do things, and I was a burden rather than that. And another guilt thing that I never realized would happen to me is that after that, and for more than a month after I was discharged, I would have night terrors. I was afraid to go to sleep. And a lot of that would revolve around that I felt guilty that I was one of the ones that survived, and maybe I was not supposed to be here anymore. And I had guiltily and selfishly taken back the chance to be alive, which I would have never thought, because I'm a very positive person. I would have never realized that. Again, Yale Health and my doctors were there to, tell me that stuff like this could happen, that people that are in ICU and are on a ventilator have a lot of issues later.
Well, I wanted to talk about that, Richard. Again, that you said that you were in the hospital for about 2 weeks. What was it like leaving the hospital? And tell us about some of the therapy, whether it was physical therapy or just talking with your doctor to figure out, am I still having certain symptoms, and how I can get back to my full functioning.
Right. Well, the first time I was in, they said I was over the coronavirus in like 3 days. They said, "Oh, you're so healthy, you already got over it." And but they kept me for 2 more days just to watch that it didn't come back. It didn't. I went home, and I had a set of, I had to have a separate bedroom, kept a separate bathroom for my wife, very, very careful, mask, et cetera, And after 2 days, my fever kept getting worse and worse until I was running 104 all the time. And so they readmitted me immediately, and that I just went like into organ failure within hours after that. That was horrible. I cannot describe how horrible it was to do that. But then as I prepared to leave, like the day before I was discharged the second time, they had, my doctors there went through, and the nurses also, even like practicing how to put on the protective gear, and how I would use the bathroom, how I would eat, how I would interact with my family, and also letting me know what I would be able to do, because I still have my lungs and my heart were damaged in the inflammation, and so I have the pain of not being able to be very active still. But what they also did, because I'd lost a tremendous amount of weight in the week. I lost like 15% of my weight, and I was a thin person to begin with. I had immediately a dietitian they assigned to me, and who set me up with a diet. I was eating 5 full meals a day, which was actually really hard to get down because I was still so ill. But to bring my weight safely up again, and not too fast, not slow, lots of protein, so much protein that I could, and that how breathing exercises and ways to try to get my lungs back. It's as if I still have, even now, I still have like pneumonia in my lungs.
And how often are you, again, whether you're seeing a doctor or talking to your doctor to make sure that you are up and up?
I have quite a team. They keep track of me by phone, by telemedicine, and procedures. I think I can safely say about 2 days per week, every week, since I left the hospital. I've been somewhere for a scan, some imaging. Because a lot of it is they don't know all what can happen to a person after this, such as 3 weeks ago, I suddenly lost half of the hair in my head. For a short while, I had that my sense of taste was off, and specific things like coffee, which I love, suddenly turned into tasted like hair conditioner. Just one day, suddenly the things with the damage to the heart and the way that it damages one ventricle, and things that it does in your lungs, and muscle weakness. So I feel like I'm partly contributing because I am the first one. So I am part of a DNA study, and to see why a person like I had this the second round called the cytokine storm. Why did I get so sick? And others, after I got better, why did I suffer this way? So they're looking, is there something in my, genetics that predisposed me to that? So I feel like I should have a parking spot down at Yale New Haven. I've been there so often, but like I say, they have been so supportive and socially and psychically and everything. They've been with me all the way, and that makes you really need that much more than I would have ever imagined.
Well, Richard, we're so glad to hear that you're doing better. But I want to ask you before we let you go, what do you want listeners to know about this disease, or how we should be supporting people in our community who are recovering, even their families? Because again, once you are discharged, there's still a process that needs to happen. And I'm just curious what your thoughts are as we see the state reopening, as more and more people are wanting to get back to normal.
Yeah, as I said, my wife and I have an acquaintance in California who died just 2 days ago. So even as things are coming back to normal, and me as much as anybody, I'm a very busy person. I want to get back out there again, but to remain extremely careful and vigilant. That most people will not get as sick as me, but if you or somebody in your family then gets it, it changes your entire life, and it's still going on. And I was very careful about washing and touching people and being in close things before I got sick. And still, I got sick. But for the family of a person who is ill, realize that part of it is just not being able to see your loved one or go visit them, or also feel like you're supporting them by coming by or sending flowers or something. All of that is off limits. So instead, I would say, instead of showering attention on the person who's sick, shower some attention and flowers and gifts and food on the spouse and the family of someone that's in the hospital.
Richard Gard, again, is a Connecticut resident. He's a lecturer at Yale School of Music, also director of music at St. Thomas More Chapel. Richard, again, we're really, really grateful that you're doing better, and we thank you for sharing your story with us.
Thank you for having me on, Lucy.
This is Where We Live from Connecticut Public Radio. I'm Lucy Nalpathanchel. Coming up, we're going to learn more about how doctors and therapists are helping COVID-19 survivors rehabilitate. We also want to hear from you. Join us, 888-720-9677, or find us on Facebook and Twitter at Where We Live. This is Where We Live on Connecticut Public Radio. I'm Lucy Nalpathanchel. Today we're focusing on what it's like to recover from COVID-19. Since the start of the pandemic, medical experts have said this disease is especially dangerous for older Americans. Many of the people who've died from COVID-19 in our state were nursing home residents. Kaiser Health News reports even when older patients survive, they are unlikely to return to their previous level of functioning. For more about this, joining us now on the phone is Dr. April Pruski. She's assistant professor of physical medicine and rehabilitation and neurology at the Johns Hopkins University School of Medicine. Dr. Pruski, welcome to our show.
Thank you for having me.
First, I wanted you to respond to Richard's story. Is it typical of people who've been hospitalized with COVID, especially if they're older?
So I think so. I think Richard has a very moving and powerful story, and a lot of the things that we know about the COVID infection and what we're learning about it is exactly what Richard said. A lot of patients, he was talking about having these dreams and things that were happening to him. Many patients are very delirious when they're in the hospital setting and they're not sure about exactly what's going on. And then they're very weak and they are having a lot of trouble breathing and trying to reacclimate to regular life afterwards, and just feeling so short of breath is a very common occurrence for these COVID-19 patient survivors.
Can you tell me briefly when someone is hospitalized and they're on certain medication, maybe they're on the ventilator, they're having problems, it's very uncomfortable, how are medical staff making them comfortable? What are some of the drugs or processes that people go through to help make these patients more comfortable while they're in the hospital?
So that's an excellent question. What they do for the COVID-19 patients in the intensive care unit here at Johns Hopkins is they're trying to actually have family members involved frequently. And what they do is they have Zoom with the family members so that they're able to interact over tablets and be able to see their family members to help calm them down through the process.
And when we talk about therapists, whether they're occupational or physical therapists, when do they come into the picture, Dr. Pruski?
So here at Hopkins, we've actually taken a very different approach. I think classically therapists come during the recovery stage. But because we know that the COVID virus is multisystemic, that we actually start evaluating these patients daily to see when a therapist can start to see the patient. And we can start to see these patients as early as in the intensive care unit. We are able to start their rehabilitation knowing that they're going to be very debilitated. We have a physical therapist come in, and that physical therapist evaluates what their strength is like. They work with them to see how they're able to kind of be able to just roll around in the bed, be able to sit at the edge of the bed. What's their balance like sitting at the edge of the bed? Then they try to stand with them and they try to walk with them a little bit. Then we have occupational therapists that come in and they work on those activities of daily living, things that we take for granted, brushing your teeth, getting yourself dressed, getting to the toilet. They start to help patients relearn how to do these things.
You can join our conversation here on Where We Live as we learn more about the recovery process for people diagnosed with COVID-19. Again, our number 888-720-9677, or find us on Facebook and Twitter at Where We Live. Jeff is calling in. He's a COVID-19 survivor and got care through Stamford Health. Jeff, welcome to our show. Jeff, are you there?
This Jeff? Yeah, I guess.
Hi, Jeff.
It wasn't Stamford Health, though. It was UConn in Hopkins.
Oh, I'm sorry. The note here was Stamford Health. So tell us, what was it like for you when you were diagnosed, and what's the recovery been like?
Wow, that's a long one. So I was diagnosed somewhere between March 22nd, March 28th. On the night of March 25th, my wife noticed I wasn't eating, I wasn't drinking, I couldn't keep food down or anything, so she called an ambulance. They came to our home in Farmington, and after diagnosing me real quick, they thought they might leave me alone until I coughed up some blood onto a napkin, and they immediately took me to a hospital in Farmington, and from that point on, after about 2 hours, I was in ICU, and a few hours later, I was on a ventilator, and I was on that ventilator for 15 days.
What do you remember about that time?
Nothing. I remember my wife calling the ambulance, and I actually sent her a text message from the hospital before the ICU trip. I don't remember doing that, so I was in a medically induced coma for all those days. And I remember coming out of it, and for about a half a day, I couldn't remember who I was or where I was or anything like that.
And now that you're home, Jeff, what are some lasting symptoms that you still have from COVID-19? What has it been like, whether it's learning to talk again or learning to do activities that many of us take for granted?
All those things, but some of them come back quickly. Walking in a straight line comes back, for me, in 5 to 10 seconds. Like you literally almost fall, and then you relearn. Typing took about 30 seconds to a minute just to kind of reacclimate. I'm a pretty good 60, 70 words a minute typist. So a lot of the menial things that you take for granted all need to kind of be relearned. Some of them come back quicker than others. Also, I lost all my muscular strength. Going up and down stairs took help from my wife. It would take, to do 1 or 2 stairs would take 2 or 3 minutes, just have to rest and then try another one. But luckily for me, I've recovered very well. It's been 2 months since I got out of the hospital, and I'm almost 100% mentally recovered. Physically, I still need to gain more strength, but it's every day I get better. Every day I feel better after a very serious, almost dying account of being in the hospital and being in ICU.
Well, Jeff, we thank you for calling in to share a little bit about what you went through. We're glad to hear that you're doing better. I wanted to go back to our guest again, Dr. Pruski. Again, we hear about what Jeff went through earlier, what Richard has experienced. What are some of the long-term side effects of COVID-19 that survivors may experience long after they've been discharged?
So we don't quite know everything that patients who have COVID-19 will be experiencing in the long term as we continue to learn. But we can draw from other conditions that we know require extensive inpatient medical care. There is a syndrome called post-intensive care syndrome, and this persists long after patients leave the ICU. Patients can have cognitive symptoms such as decreased memory, thinking problems, difficulty talking, forgetfulness, poor concentration, trouble organizing and problem solving. And really importantly is that they can also have a lot of emotional symptoms like PTSD, nightmares, anxiety, depression. They also have the physical symptoms of just this muscle weakness, fatigue, having decreased mobility, difficulty breathing, and insomnia. And I think that what Richard said before, too, about supporting the family is very important as well, because many of these family members of patients who have COVID-19 can have emotional and mental symptoms as well. They experience anxiety and depression, feeling overwhelmed. They too have post-traumatic stress disorder. They can have grief. They can have a lot of changes in their sleep. And I think that it really takes a comprehensive team to help these patients. And what I mean by that comprehensive team is that it involves having your pulmonary doctor, it involves having a physical medicine and rehab or a physiatrist who really focuses on the function and the looking at the whole person about what they want to get back to. Having physical therapists and occupational therapists and speech therapists and psychologists, not only working with patients when they're in the hospital, but working with them once they leave the hospital. And I think that Richard also said that he was having a lot of telemedicine follow-ups, and we do a lot of those telemedicine follow-ups for those patients so that when they are feeling very fatigued and are having trouble breathing, that they can connect with their physician and therapy team through telemedicine approaches to continue their recovery process.
Certainly, Dr. Pruski, this pandemic, COVID-19, has produced a new population of patients that need intensive work even after they've been hospitalized. Again, therapy. I'm just wondering, are there enough therapists who can respond to this new patient population? I'm thinking back to a Kaiser Health story that I read about hospitals. Are they able to connect people with the therapy they need because some of those resources can be limited? They may not have as many therapists depending on the patient population that needs to recover.
That's right. There is always a limitation of resources. However, we can connect patients with therapists. And usually, actually, what we tell patients about therapy is that there's a lot of homework. So it's not just about going to that therapy session. It's about the homework that you take home from it and that you practice those exercises on your own. We actually even developed a great packet for patients. It's called Bouncing Back from COVID-19 at Johns Hopkins, which kind of helps patients in a stepwise process and guideline to be able to regain their muscle strength and be able to kind of increase their tolerance and their endurance after they recover.
Dr. April Pruski, again, is an assistant professor of physical medicine and rehabilitation and neurology at the Johns Hopkins University School of Medicine. Dr. Pruski, thank you for joining us here on Where We Live to talk about what you and your team are doing at Johns Hopkins.
Thank you very much.
This is Where We Live from Connecticut Public Radio. I'm Lucy Nalpathanchel. Coming up, we're going to learn more about how hospitals are using plasma to treat people seriously ill from COVID-19. First, are you a member of Connecticut Public Radio? Do you appreciate the wide variety of conversations we have on Where We Live? Conversations that have continued throughout this pandemic? Then you can support WNPR with a pledge. Here are two members of my team to tell you more.
You're listening to Where We Live on Connecticut Public Radio. I'm Katie Tolarski here with Carmen Baskoff, and we are asking for your support today, support for local programming on Connecticut Public Radio. The number to call, again, 1-800-584-2788 or WNPR.org. I'm joining you from here in our studios in Hartford. Carmen is over Zoom at her home in New Haven. And Carmen, that's how you've been producing the show over the past months. How's it going for you?
It's been really weird, Katie. I think it's been very strange to not be in the studio and seeing all of my colleagues, seeing Lucy, and seeing our guests as well. I guess one of the strangest things is that it's now starting to feel normal to just hop on Zoom in my bedroom and pull up our show, talk to our guests that way. And I guess that is kind of the new world we're living in. But it definitely has been a big adjustment. I've been really impressed with our tech team at Connecticut Public Radio, who stepped up and figured out how to get us, continue bringing us on air from four different people in 4 different locations, plus guests all over the place. Figuring out how to do that, basically at the drop of the hat as this pandemic started. So it's been an interesting experience, but I think this has been a time that I've also felt, really invigorated and really glad to be working in news and working in public radio, because I do think this is a time that listeners have a lot of questions and really, there's so much to keep track of in terms of the pandemic, in terms of the protests that have been happening around the country, around police brutality and racial injustice. And I think valued, working on a show like Where We Live, where we have long form conversations. I think obviously getting the latest headlines is really important, but I think it's also important to have a space where we are able to kind of slow things down and break things down and have complex, nuanced conversations with policymakers, with big thinkers, and also with listeners, and bringing listeners who have questions or have comments into the conversation with our callers who join us each and every day. So I guess, if that's something that you value and you're realizing during this pandemic you're turning to stay informed, we would love your support. The number to call is 1-800-584-2788, or you can go online to WNPR.org/donate.
That's 1-800-584-2788 or WNPR.org/donate. Carmen, one thing I've really appreciated about what you and your team have been doing on Where We Live is just sort of the regular check-ins with the governor, with just folks in the state who are running different organizations, who are making decisions about when schools are going to reopen, when businesses are going to reopen. I think hearing it, it feels very chaotic, especially when you're sort of isolated in your house. There's so much news coming at you, like and things change from day to day. Having this place where, you could call in and ask a question to the governor or to the education commissioner or the Senator Chris Murphy. I think that feels like a really important public service, but also hearing those official voices, but also hearing voices from real people who are struggling in the state. And that's something that I think Where We Live does really well. So again, if you, our listeners, are tuning into Where We Live every day, if you have been listening throughout this, throughout these past months, and you are able to support this programming, please call us now, 1-800-584-2788. It's 1-800-584-2788 or WNPR.org.
Yeah, Katie, I do think, we obviously talk to policymakers on the show at all times that, in the course of our programming. But I do think this has been, a particularly important time for us to be able to have on guests like the governor and have it in a format where we are able to take listener calls and put the listeners' questions and comments directly to the people making these really important decisions right now. I think leaders in our state are having to make decisions and new contingency plans that are really unlike anything we've seen before. And having listeners giving their feedback on, what matters is really important here as well. So the number to call, 1-800-584-2788.
1-800-584-2788. Again, 1-800-584-2788. Support Where We Live, support our local programming, our local news, and all the work that we do here at Connecticut Public Radio. Again, 1-800-584-2788 or WNPR.org, and thanks.
This is Where We Live on Connecticut Public Radio. I'm Lucy Nalpathanchel. The scientific community continues to look for effective treatments for COVID-19. One of the options involves plasma and transfusions to help people fighting the respiratory disease. For more on this, joining us on the phone now is Dr. Suzanne Rose. She's director of the Office of Research at Stamford Health, and she oversees the convalescent plasma clinical trial. Dr. Rose, welcome to our show.
Thank you so much for having me today.
I said convalescent plasma clinical trial. Can you describe what I'm talking about?
Absolutely. So plasma is something that we take from people who have recovered from an infection, here COVID-19, but it's certainly been used in the last century to fight many different infections. And what's inside the plasma that is most beneficial for people who are sick are antibodies. And these are molecules that have learned to recognize and fight off a virus that has caused the disease COVID-19. So we can separate plasma from blood of people who have recovered and administer it to the people who are currently fighting off the disease, because when people are fighting off the disease, they actually don't have antibodies yet. We developed antibodies a week to a few weeks after we've actually been exposed to a virus or bacteria for the first time. So at Stamford, we have been engaged since early April in providing convalescent plasma to our sickest patients that were, in the fight of their life in the ICUs with this terrible disease.
Before I ask you more about how many of your patients have gone through this and gotten convalescent plasma, I wanted to back up, and you said that historically this has been used to treat other diseases. Can you talk more about that and how doctors were able to figure out that, again, transfusions with plasma can help people when they don't have antibodies?
Sure. So this goes back to the 1800s when diphtheria was a real problem throughout the world, and doctors and scientists figured out that if there were animals that were immunized against this disease, they could recover the blood or serum from the animals or from people who had recovered and give it to people who were sick. So certainly a lot of thought went into it then, and then we saw a resurgence of using convalescent plasma during the last pandemic of our century, the Spanish influenza pandemic, where many people died. And then from there, it's been used in the management of measles, hemorrhagic fever. It was used with success in the Ebola epidemic that occurred mostly in Africa. And recently, other coronaviruses that are members of the COVID-19 family, MERS and SARS, it's also been shown effective in those outbreaks. Even though we didn't really see those outbreaks here in the United States, it was used overseas and shown to be effective.
So we heard from two different men in Connecticut who were diagnosed with COVID, and thankfully they've recovered. So can you walk us through what the transfusion is like for someone who's had COVID and now they've agreed to have their plasma taken out?
Well, in the beginning, we were really targeting our sickest patients. So at Stamford Health, we were the epicenter in the state of Connecticut, and at one point we had 4 ICUs open. And so we did have patients who didn't require the need of a breathing machine. They did not need to be ventilated, but we did target the patients first who were on mechanical ventilators. So in that instance, those patients are heavily sedated, as you heard the two men say. They were in la-la land. They don't really know what's going on. So we actually had to consent the families. And many of these families we're still in contact with, because we would speak to them on a daily basis and give them updates and let them know when we had plasma come in, because in the beginning it was in such short supply because this happened so fast that to find donors who were fully recovered to donate plasma was really a difficult experience. So for those patients in the ICUs, we would consent the families. And then once we had plasma, it was 2 units of plasma. So each unit has about 200 milliliters of plasma. It's this gold color. And it's basically hung, transfused over 2 hours with a 1-hour wait in between. We wanted to make sure there were no transfusion reactions. And then as long as there were no reactions, the second unit of plasma was given over another 2 hours. So the whole process was about 5 hours, and I'm happy to report that we had no transfusion reactions, which, in the literature and talking to colleagues from across the United States and the globe, they also did not and continue to not have seen transfusion reactions in the patients that have been treated with convalescent plasma.
When you mention transfusion reactions, what would that be if that had popped up?
So people can get rashes, they can have trouble breathing. We certainly worried about overloading people with volume because these are really sick people, and we're talking about giving them 400 milliliters of extra fluid. And as we know, COVID-19 affects the lungs. It also affects the heart. So we were always watching to make sure there are no changes in their vital signs and their blood pressure, a rise or a drop, anything unexpected. Fevers sometimes occur when people have transfusion reactions as well.
Again, you're hearing on the phone here on Where We Live, Dr. Suzanne Rose, Director of the Office of Research at Stamford Health. She oversees the convalescent plasma clinical trial. Dr. Rose, you mentioned that people have not had side effects from the transfusion. How many of your patients have been treated with this plasma? And again, because it's a trial, I'm just wondering how much longer does it need to go forward before it's considered successful?
So we've treated 81 patients so far. 46 of those patients were in our various intensive care units. And there was one day where we looked at the list and we said, we've treated every patient in the ICU and ICUs. It's still weird to say that because we're finally back to one ICU. So then we moved out to the other medical floors where patients needed help with breathing, but were not on ventilators. And as of today, we've treated 35 of those patients that were on the general medical floors. So we've seen 52 patients discharged. 31 of our patients that were intubated have been extubated, and there's only a few that were in the ICUs that remain in the hospital. As far as when this becomes a standard of care therapy, there are large national trials going on. We actually recently joined the Mayo Clinic in the National COVID-19 Convalescent Plasma Project, so we're actively contributing data to that. We had to make a decision early on to not make this a randomized clinical trial because we just didn't have other therapies to offer patients. So there is data coming out from randomized trials, and that's basically when one person gets plasma and one person doesn't. So you can truly look at one patient versus another and say, did this have an effect? We've chosen to look retrospectively, meaning at all the patients who came in before we were able to offer convalescent plasma. And we have a pretty evenly matched population where we can start to make some conclusions. For example, in the beginning when patients were coming in, about 50% of patients in the ICU were dying. It's a terrible disease. People can succumb very quickly. One of the gentlemen talked about cytokine storm. We see that where people seem to be stable and then their immune system just kicks up this tremendous response where they become very sick very quickly and people can die from it. Since we've initiated the convalescent plasma program and also have fortunately had access to remdesivir, we have seen that number increase. So now we're seeing 75 to 80% of patients are living that had to go into the ICU and be put on breathing machines. We had one patient who was on a breathing machine for 63 days and was discharged last week. So those are certainly tremendous successes that we're very proud of in this program.
Again, we're talking with you from Stamford Health, really the part of the state that had seen a lot of cases compared to other regions of our state of Connecticut. As we move forward with reopening, Dr. Rose, what do you want listeners to think about in terms of, again, following certain guidelines to make sure that they don't contract this disease?
Well, the guidelines that the CDC have put out are the guidelines we should all be following. Social distancing, 6 feet apart. We need to continue wearing masks when we go out in public. I know certain people are struggling, saying, I don't want to wear a mask. It really protects you and it protects the people around you. We know there are people walking around who are asymptomatic carriers. And through no fault of their own, their body is just able to fight off the disease, but they're still able to spread the disease. And a mask is a fantastic way to prevent any of us that might be walking around as asymptomatic carriers from infecting people who are around us. Frequent hand washing, wiping down surfaces, certainly all of these have been shown and will continue to be very effective in preventing further transmission of COVID-19 and keeping people out of the hospital. And certainly there are trials coming out. We've heard a lot about vaccine trials. So we look forward to participating, hopefully, in some of those. But it really comes down to social distancing, wearing a mask, washing your hands, and really being cognizant that there might be some slight discomfort that we feel in wearing a mask when it's hot out, but these are life-saving measures that, fortunately, we know will work against the spread of this disease. And if people have had the disease, we would certainly say, please consider donating convalescent plasma. This continues to be the forefront of our therapy here at Stamford and a lot of hospitals around the country and in our tri-state area. So New York Blood Bank, the American Red Cross, great places to contact if you've had an infection and recovered and feel well enough to donate.
Well, we want to thank Dr. Suzanne Rose, again, Director of the Office of Research at Stamford Health, who oversees the convalescent plasma clinical trial. Dr. Rose, thank you so much for the information today.
Thank you.
We'll also link up to information about the American Red Cross, which also has a convalescent plasma program. I'm Lucy Nalpathanchel. Today's show produced by Tess Terrible. It's also our end of the year fiscal campaign to gather more support from the community for quality programs. Please support WNPR with a pledge. Here are two of my colleagues to tell you more.
And you've been listening to Where We Live on Connecticut Public Radio. I'm Carmen Baskoff here with Katie Tolarski, taking a few minutes of your time to ask you to reflect on the programming you've been hearing here on Where We Live and on Connecticut Public Radio. And if this is something that you rely on and something that you turn to each day in the 9 to 10 a.m. hour, or maybe in the evening while you're listening, to keep you informed about what's happening in our state and all of the important discussions going on during this really unprecedented time. We're asking for you, if you are in a financial position to do so, to step up and help support Connecticut Public Radio by making a pledge today. The number to call is 1-800-584-2788, or you can go online to wnpr.org/donate.
1-800-584-2788 is the number to call to support Where We Live. If you are a person right now who is glued to your phone, scrolling through Twitter, just a news junkie, one way that you can support Connecticut Public Radio and get your news on your device is for a gift of $19 a month. You can get either the New York Times digital subscription or the Washington Post digital subscription, and at the same time support Connecticut Public Radio. So that's an option for you, but most important thing is that you help to support the local programming here on Connecticut Public Radio. As we've mentioned, this is a hard time for people. Not everyone is able to give, and we understand that. So if you are able to, we're asking you to step forward. We have a $75,000 goal for this pledge drive, and it's just helping us to reach our goal for the end of the fiscal year. We cannot do it without your help. This is public radio. It's listener-supported radio. So please step forward if you can right now. 1-800-584-2788 or WNPR.org.
Again, that number is 1-800-584-2788. And Katie, I think you raise a really important point that, again, this is not an easy time financially for many people. And we definitely understand that. And I guess, to me, this also says that, if you are someone who is, relatively speaking, doing all right, financially, despite the pandemic, and you maybe are in a position that you have a little bit extra that you're able to give, this would be a really big help because again, we want our programming to be available to everyone, including people who aren't in a position to donate right now. So if you're able to step up and maybe make that contribution that allows us to keep bringing programming to people who aren't in a position to give right now because of these really challenging times we're facing right now during the pandemic, we would love your pledge of support. I think this has been a time that I've really valued public radio. And so again, 1-800-584-2788, or you can go online, wnpr.org/donate. And thanks.